I've been asked today to do a speaking to you about early help and partnership in work and how we've made it work for children and parents. And I wanted to put it into some context, really. Action for Children are one of the largest children's charities in the UK with over 600 services in total. And we campaign for early help services for vulnerable children to prevent problems such as neglect and family breakdown. And early help is one of our service offers in England, Wales, Northern Ireland and Scotland. And my presentation to you today is a bit eclectic because my role as Service Development Manager is to take the best of what we do from different places and try and share that in other places so that we learn from each other across the country what's working best in one area and can that be transferred and translated into another area. So it's an eclectic mix of what's happening in England, Northern Ireland, Scotland and Wales, but it's all under Early Help Family Support banner. And early help, talking about language, early help, early intervention, prevention, the same thing really. It's just called different things because different governments like to call it different things. So, early help and early intervention has been around a long time. It's nothing new, but I think the way we're working in partnership and innovation is really new, and that's what I want to talk to you about today. The Early Intervention Foundation states that intervening early is about addressing the root cause of social disadvantage, ensuring that everyone is able to realise their full potential by developing the range of skills we all need to thrive. It's about getting extra effective and timely interventions to all babies, children and young people who need them, allowing them to flourish and prevent harmful and costly long-term consequences. It's a prevention and early intervention approach, retaining on co-designing with communities and other partner agencies what services are going to work in this local area with these families. It's about early identification, assessment and integrated responses. It's about building stronger communities, and it's providing a single point of contact with clear information when concerns arrive and effective support provided early and locally. Our experience tells us, and I'm sure you'll agree, for it to be successful, early intervention is not done to people. It has to be developed with individuals and alongside communities. They need access pathways like a single point of contact, and it's crucial to early engagement, responding with clear, concise information and advice when concerns arise, providing effective support that does not duplicate what others are doing, but is delivered with professionals working in partnership with each other and with families. It's important to recognise that early help is not a single one-off event, but a process, and quite a sophisticated one at that. Children and young people and families' difficulties are identified before they've reached a point at which the child's development and well-being is seriously compromised. Having been identified early on, the scale and nature of these problems are properly understood, and a plan for offering help is developed through a process of high-quality assessments, and children and young people and families are then offered the help they need in line with those assessments, accept it, and this either successfully provides solutions to their difficulties or they're offered and accept longer-term support to help manage them. For early intervention to be successful, each stage of the process must be carried out and well followed through. There is little point, for example, for a child's emerging difficulty being identified and assessment concluding that extra help is required if the process stops there. I once worked at a family centre in Cumbria where assessments were part of what we did. So a 6-week assessment was done and the family was waited then. The 6-week assessment was done. The assessment report was given to someone and then the family had to wait. 6 weeks, 12 weeks later, how useful is that assessment? How useful is the service that's going to be developed then 6 weeks, 12 weeks later from the early assessment? Successful early intervention, therefore, requires a number of different things to be done effectively and in the right order. And because children and young people's emerging problems have a number of causes and consequences, it also requires a high level of collaboration between professionals and services. That high level of collaboration is really important, and we have just about started to see it in English tenders coming out from commissioners about it being a partnership bid. You might be the lead agency, but you need to do it in partnership with others. And in Northern Ireland, Wales and Scotland, our tenders there for the last 12 or 18 months is you don't get on the framework, or you don't get a tender in to be looked at if you haven't got a partnership, if you're not working with somebody else enabling your services to be joined up. The alignments that are going on in early help are young carers, early intervention, family support, health-based services, health visiting school, school-based support and statutory services. I can't emphasise enough, though, that a successful early help offer requires joint partnership working. And that happens with local and voluntary providers, with large private sector programme providers, public health, nursing, midwifery, anxiety and depression services, domestic violence services, police, social care, troubled families, job centre plus, schools, early years, education needs, nursery community, and various local voluntary groups working together to align services with the following aims. It's not an easy task to get all the services working together. And I think where commissioners are actually asking you to deliver an early intervention programme, and they're actually asking you to find out before you put your bid in who else is working there, what they're doing, how they're working really well, and you take along those partners with you that are proving to be effective, then that's where the strong commissioning has come in. To develop an explicit shared understanding of what is early help and how it supports positive parenting and empowers communities. Develop a local continuum of support which defines and connects levels of need to the appropriate level of service, to seek ensure and consistent approach to supporting parents across the partnership, and to develop stronger and more coherent links between services that support parents. Working together has been around a long time. We look at, somebody mentioned this morning, the Every Child Matters. There was a common language with Every Child Matters that a lot of partnerships and different agencies could talk to. And I really still feel that we've lost that. We've lost the ability to be able to talk to each other in a language that's understood. When you're sitting around a table with health, education, social care, police, they all come from their own perspective with their own targets. And we need to make sure that early help services delivered to children and families partners work together to ensure there's an appropriate range of early help services across that support spectrum, and needs are identified with children and families and delivered with multi-agency intensity and professionalism that the needs require, ensuring services are accessed swiftly and the cost effective by reducing overlaps and duplication and creating economies of scale, with the aim of providing and creating what is recently called a step down, stay down approach. So early intervention can happen at any time. And early intervention can go in at level 3 need, at high protection need, with the aim of bringing those children and families down a step down approach to a lower level of need. Why is early help critically? Essentially, the case for early help rests on the mounting evidence which demonstrates what happens when children and young people's emerging difficulties are not spotted and addressed. Coupled with promising evidence about the difference that programmes and approaches make, if delivered well early on after difficulties have first appeared. Early help gives families the opportunity to regain control of their circumstances and provides them with a social and emotional foundation, improving their ability to form good relationships, improve their ability to manage their own behaviour and their mental health. I think you will agree that it's much better to reduce adverse childhood experience with help before they are excluded from school or commit a crime or go into care, for the child and family, community and wider society. Some of the figures up here, 4.8 billion, the cost of youth unemployment in 2012, more than the entire budget for educating 16 to 19-year-olds in the country. 22 billion, the cost of education and underachievement per generation. The Early Intervention Foundation suggests that early intervention represents an intelligent approach to spending. It requires small investments to deal with root causes rather than the much greater cost of dealing with the after effect. Early help interventions work with different age groups, from babies to young adults, and aim to both improve and prevent various outcomes. Some interventions are very light touch, drop-in benefit, financial advice. Others attempt to reach a larger selection of the population. Others are highly targeted and work with children who are most at risk. Good quality, effective early help will also focus on the relationship between the family and the practitioner, who may be the health visitor, a family support worker, an early years teacher, or a youth worker. The worker that the family choose to trust is the worker that should lead the early intervention case with that family. And sometimes it gets taken out of their hands because other people think they know better. One of the biggest things we did in Scotland was a young practitioner who actually worked on an assessment neglect toolkit working with a family. And she was able to use the toolkit to actually have a louder voice in a core group. She'd gone to many core groups. The only person who's seen the family 3 times a week who had the least input into that conference. And after she'd done this work with the toolkit, she became more confident, and she took her work and her voice in her evidence about what was happening with this family. And when she came back, she said, you know, that really enabled me to think about, I'm the person these parents trust. I'm the person who goes in there 3 days a week, and I need to make sure that I get my voice heard in those meetings. Practitioners amongst you will know from experience that in some cases, without identification, assessment and help, children's problems become entrenched and then spiral and multiply, causing significant long-term damage for them and for others around them, and creating big financial costs for a wide range of public services far into the future. In our work, we often do surveys across our services to ask why children and families, why don't they use the services, why do they use the services, what kind of things they want to tell us about what makes a difference. One of the big barriers to accessing services is knowing where to go for help and having the confidence to go into an unknown environment. So having friendly staff and parents' help here is crucial. A lot of our work with the community is to engage parents to become mentors, parent champions who support each other to share information and services and lend a hand by going along with less confident parents to places they've already been, that they've enjoyed and they've got something out of. For example, our Tudor Road Children's Centre in Worcestershire, the receptionist is a young mum who used to attend the centre. She became a volunteer and now works and is known locally and trusted by many parents. She represents parents on advisory boards, and together they're developing a very good supportive network that feeds into all those agencies that are hoping to deliver the services that are required. Services opening times can be a barrier, especially to working parents, and having arranged different sessions in evenings and Saturdays can alleviate any barriers. Providers, we must adapt our timetables to engage families most in need. Staff resources and reduction of budgets are having the biggest impact. Budget cuts have meant that we, like everybody else, are streamlining what we offer. And being able to be very clear of what you offer being the most effective services that you're going to deliver, not the nice to have, not the one that people think, oh, 20-odd parents attending that every Tuesday and they really like it. What is it doing? What difference is it making? And what are the outcomes that you're being achieved? Most LAs have clustered individual children's centres and are clustering other services under the one management, under the one umbrella, making agencies work together better. And parents are able to attend any of those early intervention, early help programmes at any one of those places. Innovative service delivery and targeting those in need, most in need, and partnership working are the key ways that teams are responding to changes in the sector. We can't do it alone, and none of us delivering services and providing services have all the answers, all the resources, or all the ability to respond to the tenders that are coming out at the moment. They require a wider approach, they require joined up thinking, and they require partnership. The most innovative methods of practice include partnership working and parent forums, innovative service delivery such as early help, some digital communications with service users. Digital communication is extremely important as a channel to reach parents. In a recent survey of 50 of our service projects in one particular area, Parents selected social media as a preferred option for staying in touch, so text, SMN, Facebook. They're the kinds of media that parents are looking at. So developing the early health offer is an iterative process. There is strong economic argument for early intervention. The savings generated will allow further investment in children's and family services at a time of tightened budgets. However, there is also a strong moral argument for acting to prevent and limit the negative impact of a range of issues, such as neglect on children and families. Continued pressure on local authority budgets mean that it is increasingly difficult for investment in early help when pressures on other crisis intervention and statutory services remains a priority. Longer-term planning of service delivery and budget allocations will help make this a reality. And we've long in Action for Children campaigned for longer contracts. You know, if you get a contract for 2 years or 3 years, by the time you've got your engagement in and your partner's engaged and everything else, the contract's coming up again for renewal. The amount of time, energy and money spent on going for tenders and bids every 2 or 3 years has to stop. There's money being thrown away regularly. If a service is being delivered really, really well, why can't it be rolled over? If there is evidence and effectiveness and impact and outcomes and you are really making a difference to children and families, then why change it? Because procurement law says you have to. I'm raising that as a really big issue. What difference do we hope to make? Indirect service targets, working with others. We deliver direct service targets underneath a programme contract with commissioners, and then we can subcontract others to actually deliver some services that actually deliver indirect contracts. So what difference? Our strategic vision is to have services which are locally responsive, target on clearly identified need, integrated to ensure a continuum pathway of support for families and children 0 to 19 and 0 to 25 where young people have special additional needs. Empowering families to take responsibility and focused on clearly demonstration and impact and outcomes. In terms of some key facts, I'd like to finish with these figures really that you might find useful. 5,485 per young offender per month in custody. 64,809 is an average cost of taking a child into care. 4,528 for 18 to 24-year-old NEETs per year. 11,192 total fiscal cost of permanent exclusions from school as per child a year. All the above statistics come from the new economic unit cost database. When the high cost of non-intervention are compared to the significantly lower costs of intervening early, it becomes clear that any early intervention is often the better approach. I would like to finish my presentation with a quote from David Ussing, Independent Commissioner on Youth Crime, who said, "The alternative to early intervention is a grim waste of human potential, and in that context, it's a bargain." Thank you.